Hi everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates.
Hello everyone, I'm Katie and I'm one of the trainees here at Audiology Associates.
So you're in for a bit of a treat today. You've got all these patients are mine. So this one here, we basically headed this one years worth of build-up. So this patient has, well, it's been many years since they've last had their ears cleared. You can see we've got this kind of really like squishy type of, just a bit of a mixture of dead skin, bit of soft wax. Patient's been using some drops, which has obviously helped to soften this nicely for us. But it's always usually quite like tricky types of consistencies to take away.
Well, I suppose it's how far the oil can get back if it's a full blockage, you know, a bit.
Yeah, and it's coming away nicely, because this is what you want to see when you're taking this type of wax away, is that the ear canal around this wax is starting to, what's the word? It's starting to show itself quite nicely. So we've got
Okay,
a nice
so all that stuck to the canal is coming out with the wax.
Yeah, and we got a nice little plug there. We've got one little plug left. So we're just trying to, I'm hoping this is all going to come away in one go. And I think it does.
Hopefully.
I think hopefully it does, yeah.
So when you said it's a use of build-up, is this the first time they've had it done?
No, they've had it done before, but with the doctors a long time ago.
Right, okay.
I can't remember exactly how long they said, but it was over 10 years ago. So yeah, it's really strange, because you will get patients coming through that kind of say, oh, I've been absolutely fine up until now.
Yeah.
And you know, this looks like it's been in there a good old while, and you know, there's probably going to be some people saying, well, how do you not know you've got, you know, your ears full of wax? It really does kind of depend on the consistency of the wax as well. So if the wax is really wet, really soft, you won't generally tend to hear very well through that, especially if it's, you know, obviously fully blocked.
Yeah.
The sound sort of doesn't tend to get through softer wax as well as it would with a harder type of wax.
Okay.
So if it was quite a dry wax, you know, before they started using oil,
Yeah.
then, you know, the vibration, the sound would have, you know, been able to travel through that a little bit easier. And you know, when the wax starts pressing up against the eardrum, that's just going to cause all sorts of problems. So
would it depend as well on like how long it takes to build up? Because if it's a very slow, gradual one, I suppose you're not really going to notice like a sudden hearing loss, are you?
No, and yeah, you're right there. And until it gets to that point where you know, it really does kind of touch up against the eardrum or block it up, then you know, they'll be absolutely fine up until that point. So you can see a nice healthy clear eardrum. If you know your regulars of, you know, watching the channel, you will see there's a couple of little tiny spots that we've kind of left there. So we've left that one. I think this is one that you did the otoscopy on, actually. We did in my room, if you can remember. So this patient came in saying that his hearing aid was kind of feeding back and it was causing some problems. And you can see he thought it was blocked up with wax, but it's not wax. We've basically got a layer of dead skin.
Yeah, I remember this one now. Yeah.
It's just a layer of dead skin which has just struggled to migrate. In a way, it almost looked like a second eardrum.
Yeah, it was just a perfect sheet, doesn't it?
Yeah. So again, another reason why you should you know, see someone who is, you know, completely trained in their ears, as in like an audiologist, a trainee, you know, a hearing care assistant. You know, that's the kind of big difference, really. You know, somebody might actually look at that. If that didn't have a little hole at the bottom, someone probably would have looked in there and said, oh, that's just an eardrum, it looks completely clear.
They could have mistaken that very easily, couldn't they?
Oh yeah. And again, I was kind of hoping this was going to be nice and soft and it was going to, you know, come away really nicely. But you normally have these little bits that are kind of still attached, and they do usually make a little bit of noise. So we get the fine end on here to take these little bits away.
I was going to say, I remember watching the removal, and luckily there wasn't much whistling, was there?
Didn't get much at all, to be fair. It was pretty good. You're quite lucky sometimes. If it's soft enough, like what we're kind of doing here, not much more is actually bunching up, but you can slightly draw like forwards and backwards, which will just pull bits away and it'll just draw it forwards nicely. So we've got a little bit here now. These are the bits that normally make the most noise.
Is it that because they're just stuck and stubborn, or is it because they're smaller?
Bit of both.
Fair enough.
Bit of both. So if it's really stubborn, if it's still attached to the ear canal, which you can see most of this is.
Yeah.
If you get those little tiny bits, almost like a tail that's coming off the end, what generally tends to happen is it goes inside the suction tube. Because it is still attached to the ear canal, it tends to vibrate in the tube like this, and that's basically what makes it whistle. That's why you get that clarineting. And it's a horrible one, because as soon as it starts making that noise, you have to come straight out, because it is very loud. It's a really, really loud noise, and as soon as it makes that noise, you just have to come straight out.
It's quite squeaky sort of noise, isn't it?
Yes, it's not nice. I mean, you could put a little bit of oil in here to try and get these out, but again, it's a bit of an awkward position. It's right on the roof of the ear canal, this one. Now you can probably, you can see the eardrum already, which is fine. Patient is hearing a bit better, which is fine. But you will notice towards the bottom of the eardrum, and the rest of the eardrum actually, it kind of looks a little bit abnormal. So this patient has had a history of infections, perforations, which is not going to make the eardrum look very pretty once it heals. But what you've got on the eardrum, these thick white patches you can see either side of where the malleus is.
But just coming down on the left, but there.
A bit on the left, there's a bit on the right.
You can I can see now.
There. That is called tympanosclerosis, and that is just essentially scar tissue. You can see it going around the side there, look. That little sort of, what looked like a hole is not actually a hole, that's a retraction pocket. That's where the patient previously had it perforated. And it's, it's kind of healed to the point where there's like a really thin layer that's just kind of sucking inwards a little bit.
It looks like deep and dark. I was going to say, I was going to ask, is it a current perforation?
Yeah, I mean, some general otoscopes, so we use endoscopes when we're doing our procedures, but otoscope is just a little handheld device, similar to what an endoscope would look like, but you can't go very deep in the ear.
No.
They probably have updated since I've used otoscopes, but the light source never was as powerful as what we've got with the endoscopes. So to somebody using an otoscope, that probably would have looked like a perforation.
Yeah.
I've completely talked over the ruler shot and everything on that one now, but yeah, just going through a little bit of information for you guys. So I think this is the last patient. I think there's three patients in this in this perforation. 3 patients in this perforation in this compilation. Again, similar to the first patient in the video. Bit of a mixture, soft wax, got a little bit of skin that's kind of stuck to the ear canal there, kind of holding all this in place. And we're just trying to bunch it up. You can see it's just drawing little tiny bits away.
Yeah. So it's not coming off in one, is it?
No, absolutely not. Not with this consistency. We might get lucky. This is the part I said you might get lucky. So you might get these bigger portions where the oil hasn't quite penetrated into. So what you'll tend to find is you'll have a really soft kind of outer layer, and then you'll get this core center, which is really tough.
Okay.
Sometimes can be quite hard, but sometimes can be soft, but hard enough to get a good grip on.
So when you have well, this as a perfect example, when it's just like full, different consistency around the edge to the middle, would you then, like, in terms of like where to aim for, go around the edges to try and lift it all up, sort of thing?
Yeah, usually. Tends to make it easier, to be honest, because anything that looks like it's attached to the ear canal, you want to take those away first. You want to take those little bits away first, because what that can potentially do is loosen up that centerpiece. Yeah. So it'll just make it a lot easier for you. Whereas if you just try and go for the center, you'll probably just take a load out of the center and then just make it a lot harder for yourself to take the outer parts out.
So if you did aim just for the center and was just like pressing, is it like a chance that it could be pushed back depending on how hard you go, or have you not really? Not
really, to be honest. It depends on how careful you are, obviously. You've got to be super careful when you're...
Not so heavy-handed and
just shove it in, You're going to feel a lot of pain. No, it's generally a painless procedure.
Yeah.
You shouldn't get any discomfort at all with this. But yeah, you'd obviously, if the wax is not moving forwards, so if it's not coming out, you don't really want to be putting any pressure on it, to be honest. It's, you've always got to, keep the safety of the patient in mind and comfort as well.
Yeah, of course.
If you give somebody a bad experience, they're not going to want to come back.
No.
So,
put them off for life.
Yeah. So we're always super, super careful. A lot of dense hair you can see here as well, quite thick hair inside the ear. So we're quite close to the entrance here, which is why I'm kind of sort of shimmying through all this hair. We can't go right up against the wax because we're not going to see what we're doing. So I'm having to kind of hover near the entrance.
The hairs usually just sit on the outer part of the ear, but
yeah, you won't see any like newer hairs like this that are attached any deeper into the ear, because where those hairs are is roughly the same position as where the glands are that produce the wax.
Right, okay.
So again, we shouldn't technically see wax any deeper inside the ear.
Yeah.
Now you will notice, sorry guys, there's no ruler shot on this one. Bit of a strange, so we don't see it very often, but I have had it a couple of times. But the patient actually took their wax home. They actually wanted, their granddaughter is like a massive fan of, the channel, and she really wanted to see what came out, so we actually wrapped it up for him. Took it home to show his granddaughter. So yeah, nice couple of interesting cases.
Yeah.
There. We've had a couple of different procedures that were done there, but yeah, hope you've enjoyed that one, guys. I'm really not gonna even bother attempting doing the thing. I'm normally doing the middle part, and Reese does the first.
Don't ask me, I don't even know the beginning of it.
So thank you very much for watching the video, guys. As always, if you want to keep supporting the channel, you can like, you can share, you can follow the page, subscribe. Doesn't cost you anything. But if you do want to become a member, there's a little button somewhere that you can click, I believe. I'm not sure.
There's a link in the description.
Oh, there we are. Reese is in the corner. There's a link in the description that you can click onto if you would like to become a member, but obviously you don't have to. But it does mean you'll get more videos from us, and you get to see our faces a bit more often. So thank you very much, guys, for watching the video, and myself and Katie will see you on one of the next ones.
Thanks, guys.
Thanks, bye.
Bye.